Hi, and welcome to the show. Rate and review at kevinemney.com/rate. Subscribe at kevinemney.com/podcast. Today on the show, we have Cindy Perlin. She's a licensed clinical social worker, chronic pain survivor, and author of the book, The Truth About Chronic Pain Treatments, the best and worst strategies for becoming pain-free. She's also the founder and CEO of the Alternative Pain Treatment Directory. Cindy, welcome to the show.
Thank you. Thank you for having me on.
So we'll get into your article in a little bit, but first off, just briefly share your story and journey to where you are today.
So I would say that one of the biggest influences on my life was when I was 25 and I was in graduate school. I hurt my back. And that was the start of 3.5 years of 24/7 excruciating pain. And I wasn't able to find a doctor who could help me. Towards the end of that time, I went to a very well-respected orthopedic surgeon, and he spent 45 minutes with me, and he said, I don't know what's wrong with you. I don't know how to help you. This could be the way you feel for the rest of your life. And that was pretty devastating. And I didn't quite know what to do. I tried to go back to work at that point. I've been non-functional for about 3.5 years. And a friend of mine suggested that I read a book called Anatomy of an Illness by Norman Cousins. And he had healed himself from a progressively crippling joint disease with laughter therapy. He was told he had almost no hope of getting better, and he didn't like that idea. So he did some research and he came up with the mind-body connection, and that if you were in a good mental state and had a will to live, you were more likely to heal. And that book just turned my life around. And he mentioned biofeedback. So I went for biofeedback treatment. And in one day, my pain was reduced by 50%. And that was because I was in so much fear, and fear was driving the pain. I felt so out of control. And so I kept working with that and kept getting better, and then developed a foot problem that I couldn't figure out for 14 years, and neither could the doctor. And that's when I discovered there's no one size fits all for chronic pain. And that involved very deep body work to rebalance the muscles in my foot, which had gotten out of balance because of some foot surgery that I had for a bone spur. And I just got really enthusiastic about researching pain, and the opioid crisis came along, and I decided to write a book and then do a website to educate people about pain options.
So chronic pain, both for clinicians and patients, is one of the most challenging areas of medicine. So talk about your interactions with the healthcare system in terms of the attempts that they did to try to alleviate your chronic pain.
So I was enrolled in one of the first HMOs in my area, and they had a limited range of options that they offered. I was mainly medication, and they put me on all different kinds of medication, none of which made any difference at all.
What kind of medication did they try?
Well, I discovered many years later that one of them was a narcotic. I don't think they prescribe it anymore. It's called Talwin. And they gave me anti-inflammatory drugs. They gave me Valium as a muscle relaxant. I was just a zombie with that, but I was still in pain. And they put me through x-rays. They couldn't find anything. I think that if I was older and had age-related degenerative disc disease, they probably would have pointed at that and said that was my problem. So I'm very glad that, they didn't see that on my x-rays. So they just would leave me hanging, and I pursued chiropractic care on my own, and that made a tiny bit of difference, but not enough to really alleviate the pain and get me back to functioning. So, basically they were washing their hands of me and saying they couldn't do anything.
And after they did that, where did you turn to in terms of looking for other options to help with your pain?
Well, as I mentioned earlier, I was referred to a book by a friend of mine. She happened to be a health reporter, so she was kind of up on, what was coming out in the health field. And that book, at the time I read that book, I was in bed most of the time. I was seeing an osteopath who told me to do nothing but stay in bed and go to see him till I felt better. Now we know that's a really bad idea, that people's pain gets worse. But while I was in bed, just to make matters even worse, I was watching the Holocaust miniseries and reading books about the World War II and the Holocaust. And that's pretty depressing. And I had no idea that the mind and the body were connected, and what I was putting in my mind was affecting my body.
And
So,
you mentioned that you wrote your own book on this issue, The Truth About Chronic Pain Treatments, the Best and Worst Strategies for Becoming Pain-Free. Your Kevin MD article is titled, It's Time for a Reckoning in Pain Medicine. So take us into the background and what led you to write this article for Kevin MD.
well, I guess years of frustration watching the medical system continue to prescribe opioids and defend opioids and not look at other options in spite of the opioid crisis. The two are connected. We've now had many lawsuits that have affirmed that the pharmaceutical companies promoted opioids as the solution for chronic pain. Health insurance agents or companies dropped other options. When I first started to practice as a clinician, because I'm also a clinician working with chronic pain, there were multidisciplinary pain clinics all over the country that were really helping people. They were residential programs where people would get evaluated by multiple providers, and they get a treatment plan, and they'd be put through a rigorous treatment plan, and they get better. And it was the most well-validated, evidence-based treatment for chronic pain at the time. And when opioids came along or started getting promoted as the solution, health insurance companies dropped those programs. They all closed. There were about 1,000 of them at the time. Now we're down to about 50. And, we need to turn that around. We need to start looking at pain as the complex problem that it is, and that it's not a medication deficiency. And more people are in chronic pain. So just being frustrated with, policymakers not paying attention, doctors, most of them, they're either afraid of the DEA and getting arrested, which I don't blame them, or they're prescribing for new patients and still don't believe how addictive these drugs can be.
So when you say that clinicians need to treat chronic pain as the complex problem that it is, what exactly do you mean by that?
Well, first of all, it has the cause, and the causes are varied, and they need to look at what's contributing. So some of the things they don't look at is chronic overarousal from either chronic stress or unresolved trauma, muscle imbalances, nutritional deficiencies, poor diet, things like that contribute to pain that they don't look at. And, recognizing that it's cyclical. When people are in pain, they get stressed, the lack of sleep and the pain drives more pain and more stress, and they have to interrupt the cycle and get at, why people are in pain and treat it. Medication will numb the pain for a little while, but I don't know of any medication that cures pain.
So tell us about some of these other options that you alluded to previously in terms of our toolbox on how to treat chronic pain.
So one set of interventions would be in the mind-body realm, helping people get out of chronic arousal. That, as I said earlier, can come from just being chronically in stress. When you're in chronic pain, there's a lot of losses. There's loss of activities you enjoy, work, income, often relationships. You have to deal with that stress. You have to work through the trauma, which talk therapy will not resolve trauma. It'll help you understand it, but it doesn't get it out of your nervous system. So there's techniques that will get it out of your nervous system. Then you have to look at, are there muscle imbalances? Are there trigger points that are contributing? And treat those with some kind of body work, usually like massage, chiropractic, physical therapy. There's nutritional interventions. Vitamin D deficiency can cause widespread pain. They can look like things like fibromyalgia. There's inflammatory diets that you need to change. Then there are interventions like medical marijuana that are much less risky than opioids, and people who switch from opioids for treating chronic pain to marijuana tend to report that they get more effective relief with fewer side effects. And one of the most important things about marijuana is that it's been used for 5 to 10,000 years that we know of, and no one's ever died of an overdose. So it's encouraging that we're seeing more and more recognition and more accessibility through legalization so people can access marijuana.
So when you talk about exploring that mind-body connection when it comes to pain, is this something a primary care clinician like myself can do? Does this need to be referred to some type of therapist or specialist? What are our options for that?
Well, I think the problem with primary care physicians is the first problem is they don't have the time. The way that our insurance is structured now, primary care physicians can't spend a lot of time with patients, and that's something that takes time. You know, some people are completely unaware of what's driving their pain, and it takes a while sometimes to discover that what's driving their emotional distress. They don't understand it. There's something called little t trauma that people don't really think about as trauma, but it's where as you're growing up, you're constantly criticized or emotionally neglected, not having your emotional needs met. And that is often a driving force behind pain. So you really need the time to explore with people what's going on. Pain patients and all patients are very sensitive to any implication that it's in their head. And it's not in their head. It's physiological, but their brain is driving the physiology often. So it's something that generally would involve a referral. Besides time, there's quite a bit of training needed. Sometimes people without specific psychotherapy training can be very good at helping people through emotional distress, but usually it takes a trained provider.
You mentioned medical marijuana. What about CBD oil?
So CBD oil can also be very effective. With both of them, it's really important to figure out the dose that's right and the route of administration that's right, because you can use either one. You can smoke it, you can use it topically, you can take it orally. And then with both, I've seen this about CBD, there's like a bell curve that too little won't help and too much won't help. So you have to find that sweet spot that works for you. And a lot of people give up on it too soon. I'm one of those people that can't tolerate the THC in marijuana at all. It makes me dizzy, ramps up my heart rate and my blood pressure, and I can't use it at all. But many people tolerate it well, and it's really effective for them. And if people can't tolerate marijuana, if it's not legal where they are, CBD can also work well. And there are preparations out there now that combine CBD with essential oils, and that seems to be a really good combination for topical pain relief.
So when clinicians send patients to a CBD dispensary and there's a wide variety of options, what are some of the things that patients should look for when looking for CBD?
Well, I think that's a hard question to answer. Hopefully, if they're at a dispensary, the dispensary has vetted the products for purity, standardization, lack of contamination, so they're good quality products. And then, looking at the strength of the preparation and basically starting low and going high. And if you combine topical with oral, that's probably your best combination. If your pain is localized, you can use a topical right on the area of pain, and then you can use the oral as a systemic treatment. The thing about the cannabinoids that are in CBD and marijuana is that our body makes similar compounds and uses them to treat stress and injury. So, in that case, some people may be cannabinoid deficient and they're actually replacing or augmenting their natural cannabinoids. And that's why it tends to be, if they get the right dose and the right kind, it tends to be low side effect, well tolerated.
Now, you mentioned the mind body connection, you mentioned nutrition, medical marijuana, and CBD. What other options should we consider when it comes to chronic pain management?
So one of my favorites is light therapy. It started out, people talked about low-level laser therapy, which is laser therapy in the red and infrared light spectrum. And it's very highly concentrated light. Now people are using LEDs, which are less concentrated. There's home use devices. And what this does is it changes the permeability of the cells so that they can emit more cellular energy, oxygen, nutrition. Toxins can leave the cells more readily. And what happens is it promotes pain relief, it's anti-inflammatory, and it also accelerates healing. So that's something that I use myself almost daily for various ailments that I have. And I find that very helpful. Once you make the investment, which these days you can get devices for home use that are relatively inexpensive. Once you make the investment, it's there to use, for years and readily available. So that's another thing that I really like.
So I'm actually not too familiar with light therapy. Walk us through the device and the process and what kind of pain does it particularly treat?
So as I mentioned earlier, it's red and infrared light, and there are different devices. You can get very high priced clinical devices. Most devices have a small probe that you would put on the spot for a specified amount of time. So if it's a very powerful clinical device, one of the devices that I have, you would keep on the area for 30 seconds to 1 minute. That's a very expensive device. Another device that I have that's a lot less expensive, you would keep it on the area for half an hour. So timing of the dose is dependent on the power of the device. And you would basically put it against your skin and leave it on there for the specified amount of time and use it at least 2 to 3 times a week. Optimally, if it's a home use device, you could use it every day or twice a day. And as I said, it accelerates healing and reduces inflammation. So, the more you can use it, the better. So in terms of the types of pain that it helps, just about anything, muscle pain, joint pain, neuropathy, also promotes wound healing. So, once your wound is uncovered, since it has to be used, with no barrier between the device and the skin, you can use it on a wound. It's being used for diabetic ulcers. It's being used for, I don't know what the technical term is, but mouth ulcers that come from chemotherapy. It's being used in the mouth for that. It's being used for brain injury. I have a device it's called an Auragen, AURAGEN, and it's basically a hood. You put your head in the device lying down, and besides the red light therapy, you can use gamma frequency. It entrains your brain to gamma frequency, which is a healing frequency for the brain. So that's being used to treat long COVID, and that device can deal with systemic and localized pain too. One of my favorite things now.
Now, in general, how expensive are these devices and are they covered by insurers?
Well, the answer to the second question is no, and that needs to change. So you can find devices for very little. I'm not sure how good they are. You can go on Amazon and they'll say red light therapy, but you really have to look at the specifications because some of them are like light bulbs, red light bulbs, and you don't want that because that's not going to really do much for you. You want a device that is in the right frequency and wavelength range. So the most inexpensive one that I recommend is called the DNA 5 Jazz Band, and you can get it discounted for about $200. And it plugs into the wall. It's got different settings. Another thing I like about this device is it not only has red light therapy, it also has pulsed electromagnetic therapy, which is another therapy with similar benefits. It sends the body electrical frequencies that are healing frequencies. And then it also has vibration. So vibration helps circulation. So you're getting all three of those in one device. And I tried that. I had broken my ankle, and my ankle had chronic swelling, and I didn't use anything else. I just used that for about 3 weeks, and it really helped. I had pressure sensitivity and swelling, and it went away while I was using that device regularly.
We're talking to Cindy Perlin. She's a licensed clinical social worker and author of the book, The Truth About Chronic Pain Treatments, the Best and Worst Strategies for Becoming Pain-Free. Her Kevin MD article is titled, It's Time for a Reckoning in Pain Medicine. Cindy, what are some of your take-home messages that you want to leave with the Kevin MD audience?
Well, I'd like pain patients and doctors to know that there's a lot more out there than pharmaceutical and surgical interventions, and they are generally safer and more effective for chronic pain and acute pain. And for people who think they've tried everything, they probably haven't even started, because there's so much out there and there is hope for getting better. Don't lose hope. Keep looking for solutions. I highly recommend that people go to my website, the Alternative Pain Treatment Directory, which is at paintreatmentdirectory.com. At this point, there's hundreds of articles and over 100 recommended products and provider listings, and people can find lots of information there that can help.
Cindy, thank you so much for sharing your time and insight, and thanks again for being on the show.
Oh, thank you so much for inviting me.